what are the indications for bone mineral density testing? So here several clinical guidelines have been developed for use of bone densitometry in clinical practice. So the National Osteoporosis Foundation guidelines. So the guidelines are given by National Osteoporosis Foundation guidelines. They recommend bone mass measurement in postmenopausal women. Postmenopausal women who have one or more risk factors for osteoporosis in addition to age, sex and estrogen deficiency. So when should we measure in postmenopausal women who have one or more risk factors for osteoporosis in addition to the age, sex and estrogen deficiency? The guidelines further recommend that bone mass measurements must be considered in all women by age 65, a position ratified by US Preventive Health Service Task Force. So by age 65, all women. Postmenopausal women, one or more risk factors for osteoporosis in addition to the age, sex and estrogen deficiency. So in males, the use of bone density determination is not recommended until the age of 70 years in the absence of multiple risk factors or the occurrence of an osteoporosis related fracture. So what are the indications for bone mineral density testing? So age, women age greater than 65 or men age greater than 70. So men, regardless of clinical risk factors, whether there are any risk factors or not. So this age bone mineral density testing should be done. That is women age greater than or equal to 65 and men age greater than or equal to 70. Younger post-menopausal women, women in the menopausal transition and men aged from 50 to 69 with clinical risk factors for fracture. So this particular group, if they have any clinical risk factors for fracture, younger postmenopausal women, women in the menopausal transition and men aged from 50 to 59 with clinical risk factors for fracture. Adults who have a fracture at or after age 50. Adults who are having a fracture at or after age 50 and with a condition like rheumatoid arthritis or taking a medication like glucocorticoids, daily dose greater than 5 mg prednisone or equivalent for greater than 3 months associated with low bone mass or bone loss. So if any adult who had a fracture at or after age 50, they should undergo bone mineral density testing. A patient who is on glucocorticoids for greater than 3 months, they should undergo bone mineral testing. Age greater than or equal to 65 and men age greater than or equal to 70, they should undergo bone mineral testing. Younger postmenopausal women, women in the menopausal transition period and also men generally greater than 70 but 50 to 69 also. If there are any clinical risk factors, so then they have to undergo bone mineral density testing. So the FRAX score incorporates risk factors, that is what is the age, whether patient had any prior fracture, whether there is any family history of hip fracture, low body weight, cigarette consumption, excess alcohol use, steroid use and rheumatoid arthritis along with bone mineral density. So this combined, it will assess the 10-year fracture probabilities. Um, so in the United States, it has been determined to be cost effective to treat if the so when should see why we are doing all this screening, because if the 10-year major osteoporotic risk, if it is greater than or equal to 20%, and or the 10-year risk of hip fracture is greater than or equal to 3%, so in these patients we have to treat. But overall it is an imperfect tool as it does not include any assessment of fall risk, and secondary causes are excluded when bone mineral density is entered. So this is actually it's useful as an educational tool for patients, because particularly for those who are excessively worried about bone mineral density levels despite relative youth and health. And then we have this what are the indications for vertebral testing. So consider vertebral imaging testing, that is, when do we consider vertebral imaging testing? That is, all women aged greater than or equal to 70, men aged greater than or equal to 80, if bone mineral density at the spine, total hip or femoral neck is less than 1. We have done a bone mineral density, and then if that risk is bone mineral density T-score is less than 1, then then patient has to undergo a vertebral testing. So first going to what is this vertebral testing. So DEXA equipment can also be used to obtain lateral images of the thoracic and lumbar spine, a technique called vertebral fracture assessment. DEXA equipment can also be used to obtain lateral images of the thoracic and lumbar spine. So this is a technique called vertebral fracture assessment. So this is not as definitive as a radiograph. It is an excellent screening tool for vertebral abnormality. It's not spine, it is a vertebral abnormality in both women and men based on age and bone mineral density, even in the absence of any specific symptoms, since the majority of the vertebral fractures are asymptomatic for a long time. Because vertebral fractures are asymptomatic for a long time. The vertebral fracture assessment can be used to evaluate vertebral abnormality as a cause of height loss or back pain that suggests a possibility of an undiagnosed vertebral fractures. See, vertebral fractures are asymptomatic. So supposing if there is a loss of height, vertebra have come together, or if there is a back pain, so it might suggest an undiagnosed vertebral fractures. So vertebral fractures are often asymptomatic when they first occur. The diagnosis of vertebral fracture is rarely made at the time of fracture occurrence. So since vertebral fractures, whether symptomatic or asymptomatic, are associated with the same clinical sequelae, it is critical that patients with these fractures are identified. So the NOF and other organizations recommended that women by the age of 65 and men by the age of 70 undergo vertebral imaging if a T-score is less than or equal to minus 1.5. If the T-score, if it is less than or equal to 1, then the age differs. Men by age 80 and women by age 70. For younger individuals, vertebral imaging is recommended for those with an osteoporosis related fracture, height loss, or whether there is a glucocorticoid use. So these are the indications for vertebral testing. And postmenopausal women and men aged greater than 60 with specific risk factors, long-term glucocorticoid treatment, height loss, how much height loss, greater than or equal to 0.8 inch, historical height loss of greater than or equal to 1.5 inch, and low trauma fracture during adulthood, that is aged greater than or equal to 50. So these are the indications for vertebral imaging. So how do you approach this patient? So underlying development of underlying skeletal changes, it's a gradual process, and the menopausal transition affects all women by their late 50s, and so this represents an opportunity to initiate a discussion about bone loss, the role of estrogen loss and other risk factors. So FRAX has to be assessed. So this will provide a 10-year assessment of hip and major osteoporosis related fractures. There is no established algorithm for the evaluation of women who present with osteoporosis. So this is separate about the how do you approach a patient with osteoporosis. And then what are the nutritional recommendations in osteoporosis? So we have vitamin D, and we have calcium.